Hi, I'm Dr. Kit Devine. I'm a women's health nurse practitioner and the clinical director here at Fertility and Endocrine Associates. Today I'd like to talk with you a little bit about stress and the toll of infertility. Every day I have patients talk with me about how much the whole process of not only being diagnosed and found to be infertile, but understanding that they're going to require some type of fertility care to achieve their goal of pregnancy and an ongoing healthy pregnancy leading to the birth of a live child, and the tremendous emotional burden that it is. And you know, most folks say, nobody really understands what I'm going through. Occasionally, people will say, I have a friend who went through this a few years ago and it helps me to talk to her, but my parents don't understand, not even my husband understands. I'm having trouble even talking to girlfriends. It's particularly difficult if you are the oldest in the family and you have younger siblings who have children, if you are someone who married much earlier than your friends and your friends now are having babies and you can't. It's difficult to be around people with small children because that's all they talk about. That's where the center of their world is, and it is very hard when you're struggling with the same thing. And we've heard through the years, and we certainly understand how difficult holidays are. Mother's Day is just awful if you want so much to be a mother and you're not. Christmas is hard. Everybody else is in the line to see Santa Claus and you're not. One of the things that can be very helpful is to have some adult-only activities with your friends. They probably want to get out every once in a while without their children, so maybe later night dinners, maybe things that are just for couples. Or it may be that you're someone who really enjoys being around small children, and if you are, certainly that's fine. But if it causes you anguish, don't set yourself up for it if you don't have to. Try to remember that infertility, although it is unusual perhaps in your circle, is very common. We know that probably 7 million individuals in the United States alone are infertile. So it might feel like you're alone, but you're not. It's very important as patients and other people are talking with you about their experience to remember that yours is unique. Yours may not be the same as theirs. Your fertility care may not be anything like theirs because your factors are different. It's also important to keep in mind that you have every right to keep yourself away from people who are causing your burden to be heavier, and that would be friends or family who continually barrage you with questions that you simply don't want to answer. It's perfectly fine to say, I don't want to talk about that right now. Sometimes family is very well-meaning, but they just feel compelled to stay in your business. They don't belong there unless you invite them. Keep that in mind. You're in control of your own information. You get to make the decisions about what you talk about, what you disclose, and what you don't. And if you have any questions at all about strategies to make things a little easier in that regard, we're happy to help because we've heard it all.